So I'd like to thank everybody for their contributions. I'm going to read out the first question, which is for John, and then give John a chance to answer that. And then I'm going to find one for Susan so that we get a chance to get questions for both John and Susan in. So the first question then for John is from Mark, and Mark says, in terms of mental health, is any work being done to assess the availability or absence of adequate National Health Service resources to respond to mental health incidents?
Thank you, Mark. It's a good question. I think I would start by saying that previously we've presented work which shows that around 10% of all incidents comprise an aspect of mental ill health, and 20% of all frontline resource at a minimum is devoted to dealing with those incidents. That clearly addresses issues of capacity and capability for the police. However, whilst police forces for some time have spoken of the increasing role they play in managing mental ill health, to date, this hasn't been quantified prior to our work. I think Peter might be able to add that in terms of he's presented it to the Home Office. One of the reasons why so much time is spent dealing with mental ill health is it's the managing beyond the incident and the time taken by police officers to try and find resource. So one of the reasons why mental health is taking up such a significant amount of policing resource is quite clearly the absence of being able to place people with vulnerabilities in line with an appropriate resource base. It also links with Peter's broader point about austerity, and austerity serving not just to decrease policing budgets, but significantly to decrease the budgets of other public agencies that might intervene and support people with mental health difficulties. And so we have a perfect storm of police being asked to do more when they not necessarily have the capacity or capability to intervene in that area, and the agencies that might support withdrawing that support over this last 10, 15 years.
Thank you, John. Okay, Susan, I have a question for you from Ross. Ross says, where does race fit into the debate and questions over stop and search in Scotland?
Yeah, that's a really good question, because of course in England and Wales, race features really prominently in all discussions about stop and search, and it's actually very difficult to have a conversation about stop and search without bringing that race dimension in. When I did the 12-month review of the introduction of the Code of Practice, which was published last year, I included race in the analysis of the data, because the data that Police Scotland publishes on stop and search is really rich, and the information on race is clearly published. The only thing that we don't have is nominal information, so we don't know about individuals. We can only analyse the data on the basis of all incidents, and then compare the profile of all incidents with the profile of the population. And what you find is that there's a very, very kind of small inflation of a race effect in relation to those individuals who are stopped and searched, but it's very, very small. It's not anything like the kind of race dimension that you would get if you were doing analysis in England and Wales or the US or other countries. So it doesn't appear to feature, and in fact when you do more detailed analysis, I suspect that race is probably overshadowed by deprivation and poverty. In other words, people living in more deprived communities are more likely to be stopped and searched. At least that was the case prior to the introduction of the Code of Practice. It looks now like that kind of balance has become much less because of the kind of greater equality in terms of the way that stop and search is being conducted when you take account of crime levels in different areas. So good question, but there doesn't appear to be much of a racial dimension. And actually I can back that up with some current work that I'm doing around policing and COVID at the moment, which again suggests that there's little, if any, racial dimension to the use of enforcement in Scotland.
Great, thank you, Susan. So, John, I have another question for you. This is a question from Aaron. Aaron asks, interesting projection of accumulating factors for raising policing as service-based on the principle of public good and public policy. But throughout the process, does it remain a service or turned into an activity of state, which raises concerns over pluralisation of policing?
Thank you for that question. I think that question really gets to the heart of what Peter was saying about the changing context of policing in terms of that which has been brought about by the austerity agenda. It's quite clear that in a period where community-based crime has been falling, that the demands on the police have been rising and changing. This is in part, I think, because of, and hopefully so, of rising expectations. But this is because the police are de facto being drawn in as the agency of first resort, as opposed to an agency of last resort. The issue is, this is where we are at. And so what do we do to improve policing of welfare-based issues? And what do we do to get out of a situation where the police are an agency of first resource? Those are the two key questions. I would say that a lot of research, however, has shown that public safety and welfare incidents, many of these do hold the capacity to develop into a crime. So there is an interplay between these things. These are not clearly standalone phenomena. I hope that helps.
This is part of the rub we have with Home Office, that the police role isn't just crime. And many police forces will frame their principal responsibility as being one of public safety, which is a very, very broad remit. You know, in some ways it's unhelpful because you can stray into all sorts of territory under the guise of safety. But under that banner, the requirements of police have definitely changed.
And if I could just come back on that, I didn't have time to explain too much of our modelling of different demand types. But what's quite interesting is that the same factors which help you understand the spatial and temporal distribution of crime or antisocial behaviour also help explain the spatial and temporal distribution of public safety and welfare calls for service. Whilst it's not a responsibility for the police to monitor the characteristics of public safety and welfare, they do possess valuable data which we hope to shed some insight on how that data can be used to both qualify and quantify the various dimensions of public safety and welfare. Again, this is not necessarily, the findings aren't necessarily those that the police can address or should even consider to address in isolation. These findings really point to the need for partnership. The issues of mental ill health and alcohol, which are the two things that we paid particular attention to in our analysis, are quite clearly things that require a partnership approach to redress.
Thank you. Thank you, Peter, for your observations, and John, for your reply. I've got another question for Susan, which is from Jill. And Jill asks, is there a Scotland factor in this work? How far does Susan think the findings might apply elsewhere?
The old Spartan question. I think there is a Scottish factor in this to a large extent because the context is very different. I'm not sure we define the same level of decline in stop and search in England and Wales if there had been a similar issue around reform. But that's partly because Stop and Search in England and Wales has been subject to greater scrutiny for years and years. And this was relatively new to Scotland, even when the Lawrence inquiry was conducted and there was a quick look at Scotland to see what was happening around Stop and Search. At that time, really, there was no interest in the subject. But the difference in Scotland, I think, does come down to context. And Peter talked a lot about context, and I'm talking about kind of national context rather than local context. But if you consider that Scotland is, I mean, certainly in the last 10 years or so, has been developing policing based on more of a kind of explicit human rights framework. There's been a change in terms of the profile of criminal justice, particularly youth justice, which is focused much more on the growing up, getting it right for every child framework. Policing in Scotland has been moving in a direction of being much more trauma informed, and ACEs playing a kind of quite a big role in police thinking. I think all of those things have kind of shaped the way that policing is conducted today in Scotland. Now, that's not to say that the police in Scotland don't go out and deal with some pretty horrendous things, and they're at the front line and they deal with all sorts of different things. And of course, policing is not homogenous, there's lots of different aspects to it. But even if you look at the messaging around things like the COVID messaging, for example, around the 4Es, it's been much more consistent than it has in some of the police forces in England and Wales. So I think there is a kind of some element of a Scottish dimension to it. But what's interesting is when we did the analysis of the data to see whether the relationship between stop and search and crime rates was any different in Scotland to it is in England and Wales, according to the most recent research that was done there by Paul Quinton, Ben Badford and Matteo Tiratelli, we found absolutely no difference whatsoever. So although I think the policing context is different, and that has helped to shape the approach and has probably helped to steer the direction of travel in terms of a more equal and proportionate use of stop and search, I think the overall question about whether stop and search works any more in Scotland than it does elsewhere is no, it doesn't.
Okay, thank you. I've got one, probably the final question for John. Well, it's a whole batch of questions, I'm afraid. It's a question from Rulin, who says, great idea on modifying the calculation of crime rate to account for both residents and visitors. Does crime affect residents and visitors differently? Do these two groups of people have different likelihood of being either an offender or a victim? How would this new data set of who was actually in the neighbourhood where crime incidents took place contribute to our understanding of crime and its impact in general?
Gosh, that's a tough one, eh? I think the first point is to say that the mix of offenders, guardian and victims will vary according to the crime type under consideration. So our approach to defining the exposed population at risk is specifically based around understanding a particular crime type. And therefore, yes, if you contrast burglary with violence in the nighttime economy, then residents, there's likely to be a different balance of residents and visitors. I would like to stress, I think this is very important for Police Scotland if they consider the outcomes framework, and measuring the changing crime rates sensitive to the appropriate population under consideration would be a very valuable tool in assessing equality in outcomes across different types of communities and across different types of crime problem, which are lost if you just look at crime counts. So I think it's the most important point to say of its value in helping inform policing interventions. To the data itself, the mobile phone data is a really valuable resource, which is very difficult to get access to in the United Kingdom, and we were very fortunate to do so. Mobile phone data could tell you the characteristics of those people who are using it in terms of their age and gender and the the type of neighbourhood they've travelled from. We currently don't have access to such data, although I know researchers in other parts of the world do, and there's great potential in this data in helping unpick varying crime problems.
Okay, and in the name of equality, I've got one last question for Susan, and then I'm afraid to say we probably are going to have to wrap it up because we're already over time. So this is a question from Jim, Susan, and Jim says, stop and search proved to be reduced when the new restrictions were placed on it. At least that's what I heard. How do you think the introduction of the UNCRC into Scottish law will affect police interactions with young people?
Thanks. I missed the very beginning of that, but I heard the bit about the introduction of the UNCRC. I think that the relationships between police and young people have been improving significantly in recent years in any case. So the actual introduction, I'm not sure will make a huge amount of difference. It's a little bit like the introduction of the code of practice around stop and search. The change has probably already been happening up till now, so by the time it actually comes in, I'm not sure you'll see a huge amount of difference. But I know that Police Scotland has been working very closely with the Children's Commissioner, with the Youth Parliament, and with a whole range of other advocates for young people's rights. We know that crime in Scotland that's committed by very young people, particularly those under the age of 14, has declined very significantly in recent years, and that's part of the overall crime drop in Scotland. But what we also know is that those young people who continue to be involved in crime and to come to the attention of the police are often the most vulnerable and the most disadvantaged. So the use of a human rights framework to help and support those young people is hugely important. But what's even more important is that the police can't deal with all of those issues by themselves. So issues around collaborative working and responses which enable the police to have reliable referral mechanisms in place are really, really important. So, for example, the change to the age of criminal responsibility in Scotland, which was passed last year, is a momentous shift. I mean, it might not sound very much to increase the age of criminal responsibility from 8 to 12, but actually that's been decades in the making. It's been called for many times before, and it was a real challenge to get it over the line. But I think in terms of what it means to children and young people, it's hugely important that the police are supported. For example, that places of safety are available, that the government does its bit to make sure that there's sufficient resource for those young people who continue to need help, that the social work department has people available to work with those young people, that there's counselling services that enable things like mental health and alcohol or drug related counselling to be there for children and young people. So I think in terms of a lot of the groundwork that's already been done, but the devil's in the detail, I think, in terms of making sure that all the support services are there.
Okay, thank you. So all of the speakers are able to hang on. So we're going to field the last couple of questions, which I think are both to Susan. I will just check that that's absolutely the case. So the first question then is from Mark, Susan, and Mark says, did you consider the potential for dispersal effect of stop and search, i.e. does an increase in stop and search in area A result in the issue moving to an adjoining area Z? I think that's a fairly straightforward question, Susan. So I'll ask you the second question as well whilst I've got the floor. Okay. And this is another question from Ross. Ross says, does the link between the use of stop and search for drugs and subsequent increase in drug-related offences perhaps allude to a chronic and established lifestyle featuring drug use by that individual that is not as established by those who would not go on to commit offences, which are perhaps more opportunistic and context-specific, such as violence?
Great, thank you. If you know Mark Hollinsworth, you know he never asks an easy question. This is a really good question because it's essentially about displacement in the effect of stop and search. Unfortunately, in this particular piece of work, it wasn't possible to look at displacement because, as Mark knows, you need small area statistics, and we were looking at multi-member wards, which are still pretty big geographical units. And I would love to be able to do analysis at more localised levels, for example, data zone, but Mark will have to give me the data in order to be able to do that. So back to you, Mark. But I suspect that where there is dispersal effect in stop and search, it's probably relatively low level, because actually because of the massive decline in the numbers of stops and searches, with the exception of some very specific localities, the numbers of stops and searches in even multi-member wards can be quite small. So the likely impact of a dispersal effect is probably quite low. But I think it may happen in areas where you have larger use of stop and search. So it'd be interesting, for example, to do some testing of the data in areas of the West, where we know that stop and search is still more likely to be used than in the north and the east. But definitely something, if Mark wants to give me the data, I'd be happy to have a look at. And Ross's question about the link between stop and search and drugs. Yeah, this is very interesting, and something that we've actually discussed with the National Stop and Search Unit in relation to this. It's a question that can only be answered really by further work. Probably more qualitative work at a divisional level, looking at policing strategies. But I think you're right that there are some individuals who do have chronic and established lifestyles that feature drug use, and that stop and search is probably not likely to make much of a difference in terms of those individuals. In fact, it's been one of the theories about that kind of positive relationship between stop and search and drug use is the potential that if you take drugs away from an individual, and then that's the totality of the response, then that then puts that individual in a position where they need to find more drugs, and that could lead to the potential for more drug-related crime and drug-related harm. So it was something that the NSSU were interested in looking at, whether in some divisional areas there might be a slightly different response, and that the use of stop and search could be used in tandem with a kind of referral type mechanism, where someone doesn't just have the drugs taken away, but actually that's used as a kind of mechanism for referring them into some sort of treatment. I mean, it's not nearly as easy as that, because we know that those individuals that have chronic addiction problems are very, very difficult to work with. They lead chaotic lives, and again, policing is not going to solve those problems. But I think I would just say that if we had more intelligence or more qualitative research, we might be able to understand some of those relationships a little bit better. So that's a question for Kirsty in terms of taking forward the strategy that she talked about around increasing insights.
Okay, so I think we're probably around about 10 minutes over, so it's probably therefore a good time to wrap things up, and just to thank John and Susan and Kirsty and Peter for such interesting papers and observations, and to thank everybody who wrote the questions. I think, I'm just fact checking for the last time, I think we've managed to get through all of the questions, which I didn't think was possible, but we've managed it. So well done for having such good questions, and well done to the presenters for answering them so concisely. So without any further ado, I'd just like to thank everybody, and to thank you for all turning up for the webinar. Thank you very much.